Good morning to my super awesome and passionate and hardworking and well veterinary colleagues. My name is Dr. Quincy Hawley, and I am the co-founder of Get MotiVETed. And on MotiVETed Mornings, we aim to bring the veterinary community high quality, slightly entertaining, and informational content to help us achieve our purpose of making poor veterinary well-being a thing of the past. And I'm so excited that you decided to join us for another episode of MotiVETed Mornings. We have a very exciting guest who's going to be on today, and we're going to be having an extremely powerful and empowering conversation with Dr. Barry Feldman. He is a PhD clinical psychologist who specializes in the study of suicide, and he has been collaborating with us at Get MotiVETed, and we're so excited to have him as a part of our team. I really hope that you all thoroughly enjoy today's conversation, and if you enjoyed the message, please let us know about it. And if you do like it, make sure you click the like button on our YouTube channel and also subscribe to our YouTube channel. We greatly appreciate it, and it lets us know that the work that we're doing is adding value to whoever you are and wherever you are. With that being said, enjoy the show. Well, welcome to our third episode of MotiVETed Mornings. I'm Dr. Quincy Hawley, and this is Renee Machel, and we are the co-founders of Get MotiVETed, which is a company that provides well-being solutions for all members of the veterinary community. And we're extremely excited because we have a guest today. But if this is your first time tuning in to MotiVETed Mornings, our purpose as a company is to literally make poor veterinary well-being a thing of the past, and we absolutely know that we can make that so.
Absolutely.
Yes,
and we look forward to bringing skills like personal development and mindfulness as part of the wheelhouse or toolbox for members of the veterinary community to use in making that so.
That's right. Now, today we actually have a very special guest, and we're really excited because we met Barry Feldman was it Schaumburg, Illinois? Schaumburg, Illinois, at the AAVMC, AVMA, and Zoetis hosted Wellbeing Summit. And Renee, I believe that you met him initially, right?
We did, yes. Barry and I touched base in Schaumburg, and then we followed up back when we were in our own home states with great conversations. He lives up north, and we're in North Carolina, so we were able to do a couple telephone calls, and then luckily he has family in North Carolina, so both Quincy and I got to sit down with him and have another outstanding conversation. I always have a really great time talking with Barry and sharing the information that we have to share and learning more about each other, because it's such a unique thing that is created when the conversation really just gets started.
Absolutely. And with that being said, Barry, welcome to the call.
Thank you very much.
Yes, thank you for joining us today. It really means a lot to Renee and I to have you here.
So with all of that being said, tell us a little bit more about yourself, both professionally and personally, Dr. Feldman.
Well, let me start with the more fun part, which is personally. I'm the proud father of 3 adult children, and one of whom does live in North Carolina, and 3 beautiful granddaughters that also live in North Carolina. So, that's not the only thing personally that defines me, but I'm very family-oriented. And as I say, my kids are adults now, although, as I like to say, the umbilical cord does not necessarily it stretches pretty long and pretty far.
Absolutely, yes.
So anyway, that's a little bit on the personal side. What else? I'm an EMT, but mostly in a fun way as a ski patroller, which may be foreign to some of the folks who live in the more southern parts of our nation. But that's given me an entree into the emergency medical services world, which has been a big part of the work that I do. So with that, I'll kind of transition a little bit to my professional world. I'm Dr. Barry Feldman, and I'm an assistant professor and director of psychiatry programs in public safety at the University of Massachusetts Medical School. I'm a suicidologist by specialization, meaning that my clinical teaching and research focus areas are around suicide intervention and prevention.
Mm-hmm. Yes.
That's awesome. And Barry, when I first found out that you were a suicidologist, I had never heard of that term before, so it was a complete eye-opener to me that even existed. So are there like a ton of throughout the United States, or are you like the only one in the world? How does that work?
No, absolutely not. There's a very large community, both nationally and internationally, of individuals, doing work in suicide prevention.
Mm-hmm.
Many of them work in academia. Many of them are clinicians, and so on. But no, I'm certainly not the only one. It's not necessarily a card-carrying member-type club. But anyway, there's a lot of very talented, bright people that I've come across, in the course of my work. People that I consider colleagues. People doing very interesting and, often difficult, but very meaningful work.
Yes.
I remember the first time I was about to attend a conference, national conference sponsored by the American Association of Suicidology, which is one of the national, international suicide prevention organizations. And I was telling some of my friends about that I was traveling to this conference. I believe it was Washington, D.C. at that time. And they asked what the conference was about. And I told them. I told them who sponsored it, and I told them it was, the name of the conference, that it was sponsored by the American Association of Suicidology. And one of my friends looked at me and he said, "Ooh, sounds like a fun group." But I really want to reiterate, as I said earlier, the work that people do. It's tremendous work. It's difficult work.
Right.
But, try to have fun along the way as much as possible.
What similarities have you found between working with first responders and within the veterinary profession?
Well, the thread that has consistently run through my work has encompassed helping the helpers or responding to the responders. I learned early on when, in my first full-time faculty job, there was a local family that wanted to fund some work related to suicide prevention. They unfortunately had lost an adult child to suicide who, by all appearances seemed very successful. He was an attorney and, financially well off and so on. And like often happens, they were shocked and, devastated by that loss. And they wanted to fund some research related to suicide prevention. So I decided to undertake that project. And in the course of doing my research and getting more familiar with the issue of suicide, the problem of suicide, I realized that first responders, police in particular, firefighters and EMS personnel, had elevated rates for suicide, and that it was a significant problem in their professions. So that was a kind of an epiphany for me, and started me down the path of working in suicide prevention realm. But not everything encompasses suicide, of course. There are many points for intervention before things can escalate to that point. So helping the helpers or responding to the responders is essentially, as I said, has been the focus of my work. And I learned several years ago now, when I started working with members of the veterinary profession, that certainly veterinarians and other veterinary medical professionals are considered to be in the realm of helpers and helping others, whether it's helping animals, and obviously helping the animal owners, dealing with them.
That's right.
So they're in this helping world as well. What really caught my attention was a report from NIOSH, which is the National Institute of Occupational Safety and Health, which identified veterinarians as ranking 4th among professions for suicide rates. That was pretty staggering to me, even though I've been involved in the suicide prevention field for a long time. So ranking behind physicians, human medical providers, dentists, which many people know, dentists are up there somewhere. 3rd are police officers, and 4th are veterinarians. So that indicated to me that members of the veterinary profession represent a vulnerable population. They're exposed to trauma. They're dealing with traumatized individuals, and as a result can experience what's called vicarious traumatization. And they're expected to just sort of stuff their emotions and carry on and do their work, which can be very challenging, very daunting to do.
Yes.
So essentially the veterinary profession is about people helping others, both humans, the animal owners, and animals of all species. And as a result, there can be many emotional and physical challenges in performing this work. And what I have often experienced in working with helpers or responders is that one's professional experiences and personal experiences, their professional lives essentially and their personal lives are inextricably entwined, such that the professional affects the personal and the personal affects the professional. So there's a lot of linkages with my work that I started many years ago with first responders, and my work more recently with members of the veterinary medical profession.
Oh, so well said, Barry.
Yes.
So well said. Now you mentioned something, if you could talk to the point of vicarious traumatization.
Vicarious traumatization, also known as secondary trauma syndrome, that be the one directly traumatized. But rather they would be working with, or secondhand trauma exposure, working with trauma victims, working with individuals who have been, for example, easily identified, like sexually abused, physically abused, and so on. Clinicians, mental health clinicians that work with those populations. First responders who respond on scene to, very challenging, difficult situations. They working with the victims, talking with the victims and family members and so on, and by virtue of that kind of exposure can actually develop symptoms that are very akin to post-traumatic stress disorder, which everyone is, pretty familiar with these days. Certainly more people are familiar with that. So vicarious traumatization, not directly traumatized, but this secondary impact of the trauma.
Very important, very powerful.
Yeah.
So certainly veterinarians, in dealing with the incidents, critical incidents in their world, and members of the veterinary profession, euthanasia type situations we know can be very challenging, and dealing with the animal owners whose animals are euthanized, or this was experienced also in some of the disasters, the mass casualty disasters, Hurricane Katrina,
absolutely.
Situations like that where veterinary medical professionals are on the front lines and trying to provide assistance and support and so on. So even though they're not directly impacted by the trauma, by working, as I said, with those who are directly impacted, you can experience this secondary trauma or vicarious traumatization.
And one thing that you mentioned, Barry, earlier is that you were unaware that veterinarians were so high on the totem pole as far as suffering from poor well-being. And having been in this line of work as a veterinary professional that focuses on well-being, I get it so often when people ask me what I do. They are so surprised to find out that veterinarians are going through the suffering that they can go through. It's not everyone, but it just goes to show, in my opinion, that there is a very I want to say confused viewpoint of what we actually do as professionals, that maybe most people think that we're playing with puppies and kittens all day, as opposed to the actual work that we do on a day-to-day basis, and some of the vicarious traumatizations that we're actually going through on a frequent basis. So that's really, really interesting, and I hope that through Get MotiVEted that we can increase the awareness to the general public, to the general population, that, you know, being a veterinarian isn't a it's prestigious in my opinion, and I love the work that we do, but it's not a very glorious or profession necessarily in terms of just...
I've taken great pride in my work, but I think you're absolutely right. It's not romantic.
No,
you know,
not at all. Not at all.
And yeah, I think sometimes people probably romanticize it.
Right.
In a sense.
We saved the day. The puppies, you know, or they're hit by a car. We fixed it. And
yes, and you mentioned how intertwined people's personal and professional lives can be, and I feel as though there was a time, and it sort of surfed into my generation of being raised to say, you know, there should be a hard line between work and home. But when you're in a profession, we've talked about the demographics shifting even toward even a higher degree, 80% of women in the veterinary profession, you start to even more see this blend of a personal life with your home life. And depending on what types of leaders you're working with, whether it's an enlightened or compassionate leader who understands, like Dr. Hawley talks about often, we are humans first, and veterinarians or veterinary professionals second. And so what we're lacking sometimes is the skills in order to be our best selves and to combat some of those traumas or experiences that we've had where it's not in our training of how to do the job.
Absolutely. Beautifully said.
Yeah, I mean, the elusive, you know, we hear the term work-life balance. And, you know, unfortunately too often that's just a phrase, but it's not typically paid attention to.
Right.
And clearly, you know, to your point about the demographics within the veterinary profession, predominantly female, you know, which is interestingly very different than the human medical profession, which is more, you know, male doctors, more males, you know, in that capacity. profession has also become more aware of the burnout related issues and the problems within the profession, but real kudos to the veterinary medical profession who that seems to really be and get motivated in particular, that really seems to be tackling this issue and really trying to do something about shifting the work-life balance in a more positive way towards the family side or the personal side, if you will.
Right. That's a very good point, and I think it's so important that no matter the gender, which, it's wonderful to be working with two males here, but no matter the gender, that people are bringing it to light, regardless of their career or their gender, that as a human, it's important to be having these discussions and to keep that in the focal point so as to not suffer individually, and then, of course, if there is suffering, that we can promote intervention.
That's right. Now, Barry,
Sure.
When we first met you at the Wellbeing Summit, you were a keynote speaker, so you obviously, or I hope that you like to speak publicly on stage in front of audiences. What do you like most about speaking in general? And then what do you like most about speaking to veterinary groups? So you've spoken at schools and you've spoken at the Wellbeing Summit. What do you enjoy most about that?
First I'll kind of talk about the veterinary groups, veterinary profession. But it starts with the fact that I've been an educator and trainer for many, many years. So I have, extensive experience and feel comfortable in conveying my material, both, evidence-based material, anecdotal material from my work. And frankly, public speaking and in general enables me to reach larger audiences.
Right.
So the opportunity to speak to members of the veterinary profession was really, really interesting to me, and hopefully interesting to folks in the audience, because relative to the issues we're talking about, burnout, compassion fatigue, suicide, well-being, within the profession, it's important to provide education on these topics and thus raise awareness, certainly of the problematic areas, suicide, as I mentioned, among the ranks of the profession, the opportunity to disseminate evidence-based information, and also providing practical intervention suggestions can be beneficial for folks to help recognize struggling colleagues or coworkers.
Yes.
It might be suicidal if things have reached that point, or just struggling in general, with some emotional issues or psychological issues, and really how to help them access professional help before things do get worse. So the speaking opportunities provide me with a platform to reach larger audiences.
It really sounds like speaking is a hidden passion of yours, almost, And you've spoken at a veterinary conference before. You've spoken at a veterinary institution or two, I'm sure. I hope that you can get more speaking opportunities as you move forward with the work that you're doing, so that you can reach those larger audiences, because you bring a really unique perspective to veterinary medicine and sort of veterinary well-being that hasn't really been emphasized just yet. So.
Right. I think there was someone at the conference, and even our hospital program director had mentioned it to us the other day, that is recognizing it within your team. And once you recognize it, what do you say? How do you approach that conversation?
That's right.
And you were able to shed some light on that, and very simply just starting the conversation, can be the one stepping stone to doing that. But then, like you had mentioned, is what signs do I need to be looking for? So no matter who you are within the profession, if it's not yourself, understand that we are vulnerable individuals and it is the environment that it is, can I be looking out for my fellow colleagues?
Sure.
Right.
Mm-hmm.
I mean, I've experienced situations in my work with law enforcement officers, as an example. I've seen people. Well, let's face it. People are made of flesh and blood and bones. They have emotions. They have reactions, and they have feelings. When people are in operational mode, doing the work they're trained to do, such as in the veterinary medical profession, they oftentimes get on automatic pilot. The training, the many years of training and so on kicks in, and they do the work that has to be done. But no one is really immune from emotions and reactions to what they've dealt with or what they've experienced. So how people handle them, certainly starting by acknowledging them, but then being able to handle those reactions in a meaningful way is important. And let's face it, sometimes people can get overwhelmed.
Yeah.
But the ability to, I'm not saying this really how I want to say this, the ability to recognize when one needs help themselves. Very frankly, very simple words that I go by. How do you help? You can't help others unless you help yourself first.
Absolutely.
Absolutely.
Yep,
You gotta put the oxygen mask on.
Yes.
Yeah. So we've had a couple conversations, but very early on in our relationship, what interested you most about collaborating with us at Get MotiVETed?
In the subsequent conversations that I've had with both of you, it became quite clear to me that the overall focus of Get MotiVETed and the mission is to enhance well-being of veterinary medicine providers. And it starts by recognizing the impact of excessive physical and psychological stress, which, as we've been saying, can often be manifested in burnout and compassion fatigue. And by the way, both of which are strongly linked to depression and suicidal behavior. So those perspectives and that mission, that focus is very consistent with my perspectives and my goals. And Get MotiVETed, frankly, offers practical suggestions and strategies that people can use, and strategies and suggestions that can impact change at both the organizational and individual levels. But very simply, the people involved in Get MotiVETed, obviously, yourselves in particular, very nice, smart, and extremely motivated, no pun intended, to help make much needed changes within the veterinary profession. And folks that are not just interested in, having dialogue about it, but, along with the dialogue, actually doing, some things to affect change.
We appreciate that so much.
Yes, absolutely. And, it's been so easy for both Renee and I to push this mission forward of providing strategies, tools, and resources for the veterinary profession because, as we stated many times on the first 2 episodes, we had our own personal struggles, and I had some really, really dark days. But with the tools, the strategies, and the resources, if you have that toolbox, it's not so much to actually, it makes it a lot easier to go through those struggles and to go through those tough times. And I lean on mindfulness. I lean on continuously advancing through personal development. I had that toolbox of reading tons of books, of listening to a lots of motivational speaking and listening to audiobooks, and then I had some great mentors that came into play as well, and there's just so many other tools and resources out there. But Barry, if you could give one piece of advice to an individual, because we have a growing viewer base here, and there may be an individual out there listening to or watching this video right now who may be struggling, like what one piece of advice would you give to that individual who's maybe going through a personal or professional struggle, or maybe even both? What's the best that you got, Barry?
Well, the best that I got. Well, I would be remiss as a suicidologist if I didn't start out by saying, if there's anyone who's listening and watching this interview who is having suicidal thoughts, then at the very least they should. There's a national crisis line. It's 1-800-273-TALK, TALK. That I strongly recommend that they, reach out and get some help if things are, of that proportion, or they go to the nearest emergency department and, as I say, if they're suicidal. I think that's probably the most important piece of advice I want to give, and I typically would say that.
Absolutely.
So starting with that. In addition to that, or if things are not necessarily of that, magnitude, very simply, before people can effectively take care of others, as I said earlier, animals or humans, they must first help themselves. So if you have a friend or colleague that expresses concerns about how you're acting or your behavior or the mood, if you seem depressed, then please don't minimize or deny concerns that might be expressed in that regard. Frankly, those around us know us best.
Interesting.
And also, similarly, if you are concerned about a friend, a colleague, or a loved one, then please get involved and engage in trying to help them or help them access mental health services if that's what's required, rather than engage in avoidance type behaviors. Oftentimes we professionally we do things with our clients and the work that we do, but when it gets personal, as people might say, they don't want to get involved with their coworkers or their friends or loved ones. They kind of stay away from that area and they avoid it. So I really think people need to get involved. If they are concerned, please take some action by getting involved. And very simply, lastly, it's important that please take care of yourselves, take care of each other, and to stay safe. That encompasses a lot of things that people can do, but those are the words that I think they're really important for people to consider. Get involved when you're concerned about a friend. If you feel that things are not working well for you, and if you're hearing those concerns expressed by others, then pay attention. Pay attention.
Yeah.
Awesome. So get involved, and I think that's a really big one, because a lot of people, myself included, probably would have run from, if you notice something about someone else, then maybe you feel bad about actually bringing that up to them, or maybe if you're having struggles with yourself, you feel a little bit. I'm just going to say scared or fearful of bringing that out to the forefront, but as you said, Barry, that's the most important thing, or one of the most important things that you can do is to just say something, get involved, say something to your friend, take a nice long look in the mirror, whatever you need to do, and then you said the two words that
I absolutely adore these days. Take action, not just any action, take massive action towards getting your life to exactly where you want that to be.
Right.
I've been involved in too many unfortunate situations after, completed suicides, or, where many times those left behind have, they're just so saddened and guilt-ridden, much of the time because they didn't get involved. And I just thought that was so-and-so being, acting crazy, and that was their business, and not my place to get involved. But
Right. That's
if you don't get involved, then unfortunately the results can be very catastrophic.
That has to be really, really tough to be in that situation where you could have taken action, but for whatever reason you held back, and you have a result like that. So
and maybe things aren't that bad, but that's okay. At least get involved and find out that things aren't that bad,
Right.
But anyway, I can't overstate that enough.
Yeah.
I can't state that enough, I should say.
That's very important. Yeah, that struck a chord. That struck a chord for me. Early on in my 20s, when I was significantly impacted by both anxiety and depression, my colleagues are the ones that got involved for me.
Great. Sounds like it had a great outcome for you.
Yes, it did.
absolutely
It did. Mm-hmm.
brought you to me.
That's right. Yeah, brought me here today.
That's right.
Mm-hmm.
I think people's stories, stories that you share, are very powerful. Have people having lived experience, so to speak. Been there. It's one thing to be able to talk the talk. It's another thing to walk the walk. And it's another thing I admire about working with Get MotiVETed, with you folks in particular, of course, is that you walk the walk, and that's important. I don't know what it's like to be in the shoes of a veterinarian or a veterinary medical profession, but a lot of my knowledge, a lot of my experience is hopefully will be valuable to your audience.
I'm certain it will
Members of the profession.
I'm certain it will be.
Absolutely.
Yes, you've enlightened us just in the short time that we've known you, Barry, and I'm certain that we can shed light for others in the community as well by working together and bringing you to them as well as a resource. Do you have anything else that you'd like to share, or if you'd like to circle back to things that you keep in your well-being toolbox?
Well, I think in the well-being toolbox, it's I alluded to it earlier. It's a recognition that your job should not define you.
Mm-hmm.
That people should have other roles in their lives.
Yes, yes.
It's the same thing I say to whether it's police officers or veterinary medical professionals or people who work with traumatized individuals.
Mm-hmm.
That you need to have some things in your life to enable you to have fun. And whether it's gardening or golfing or fishing or being involved with your family, being a father, a mother, a dad, a husband, a wife, just things outside of your work.
Mm-hmm.
Research all the way back to the mid-'80s, I think, stress and coping literature talks about the importance of having multiple roles, a person having multiple roles in their lives. And so if the profession becomes all-consuming, then that's can precipitate a number of problems, no doubt about it.
That's important. Good.
That's
Very
right.
good.
That's right.
Okay.
That's great advice. Great advice.
Well, Barry, thank you for calling in today. Viewers and audio listeners, we hope that you enjoyed this episode, our third episode of Get MotiVETed Mornings. And again, if you have any comments or suggestions, any sort of reaching out that you'd like to do with us, feel free. We're always here for that. And if you'd like to share your story, again, we're here as well. And we look forward to the next episode of MotiVETed Mornings.
That's right.
Help share our mission and our vision. If you like this video, share it with your friends. You never know who might be the person that needs to hear this video that day.
We appreciate you tuning in, and please subscribe to our YouTube channel. We greatly appreciate that as well.
Yes.
But otherwise, we'll see you next week.
Signing off, waving. We're all waving.
Yeah.